In today's new notebook, Angelica Carrillo talks with an audiologist about other options if hearing aids aren't helping.
In today's new notebook, we have Dr. Greg Swingle back with us. He's with the Arizona Hearing Specialist. Thank you so much for being here.
Yeah, thanks for having me again.
Yes, of course. So today we're specifically talking not only about hearing loss, but about different sorts of ways to fix the hearing. What happens when hearing aids are not enough?
Well, hearing aids are really fantastic, but basically what they do is they amplify sound. When you have a hearing loss, you can't hear soft sounds very well, so a hearing aid will turn it up. That's really, really helpful for a lot of people. However, sometimes even if it's loud enough, a person still doesn't hear very clearly. So a cochlear implant is something that we start to discuss at that point. Cochlear implant is really the job of a cochlear implant is to more or less replace the function of what the inner ear, or what's called the cochlea, does. That's why it's called a cochlear implant. There's thousands of little hair cells inside that cochlea, and their job is to transform sound waves into nerve impulses for the brain. So if that's not happening correctly, then you have a certain type of hearing loss that hearing aids end up not being as helpful.
We're seeing some images of that. How does the system work?
Yeah, so there's really two major parts of it. The part that goes inside, that's the implanted portion. There's a piece called an electrode array that goes into the inner ear, or the cochlea. That's really truly trying to replace what the inner ear hair cells do by stimulating the auditory nerve directly. So that electrode array is a really important piece of things. And to receive the signal, you have a little magnetic type of receiver up here. And so all of that is inside, under the skin. And then you have an external component that has a magnet as well, and then that sits up here, and you have a little processor, oftentimes on the ear, but sometimes it's totally up here as well. But that processor is what picks up the sound with the microphone and sends it to that internal component.
How do you determine if it's right for a person?
Well, obviously we're working with people all the time with hearing aids, and if we start to see a situation where the hearing aids aren't as helpful, then we might recommend a cochlear implant evaluation, in which case we do a lot of speech testing. We play a lot of words and sentences with their hearing aids on, and we see how they do. And if they get a certain type of score, then that might mean that they're probably going to do actually better with a cochlear implant instead. So we would recommend them see a neurotologist for the surgery, or they'd have a consultation, obviously, to make sure that medically it's appropriate for them. But after they consult with the neurotologist and everything seems to be a go, then at that point they would just schedule the surgery and have the internal component taken care of. And then after the healing, usually a couple weeks, maybe a month or so, then ultimately they'd come back to us for the rest of the auditory rehab process, and that is learning how to use this new type of hearing technology. If you don't hear very clearly with a hearing aid, even, then a cochlear implant sometimes can go beyond what that hearing aid does and actually helps you hear clearly, but it's a little bit of a training process to get there. So.
Yeah, definitely. Dr. Greg Swingle with Arizona Hearing Specialist, thank you so much for joining us today.
Yeah, thanks for having me.